When it comes to things your body is telling you, there are some health symptoms you should never ignore. Research has shown that during the pandemic, up to 40% of women reported that they skipped preventative health services and routine checkups. So joining us now to discuss and update us on the many health ailments women may want to ignore but shouldn't is Dr. Nkechi Azie. She is the VP of Clinical Development for Synexus, and Barbara Dean. So thank you so much for joining us. Nurse Barb, let's start with you. How big of an issue was women skipping preventative health services during the pandemic?
It was such a huge issue during the pandemic that women skipped their preventative services like their annual physicals, their pap smears, their mammograms. And Dr. Azie and I are delighted to be here on behalf of Synexus because it's Women's Health Awareness Month, and we can change that. Because women delayed not only their annual physicals, but they also delayed talking to a provider about those really pesky symptoms like vaginal infections that never seem to be going away. But ladies, let's change that. So in honor of May and Women's Health Awareness Month, now is the time to focus on your own health care.
Yes, a good reminder. So Nurse Barb, what are some of the health conditions that women might want to ignore but that they shouldn't?
Well, it's so normal and natural to want to ignore some of those very personal and private conditions like vaginal infections that never seem to go away. And so often we think that we're the only ones, but the truth is that if you're suffering with a yeast infection, you're not alone. 7 out of 10 women will have a yeast infection at some point in their life, and half of us will have multiple episodes. So don't let fear or embarrassment prevent you from talking to your healthcare provider, because there have been some new treatments that have become available.
So you're saying there's 30% of women out there who have never had one or will never have one? Okay, but that's a small number compared though. So doctor, why is it important to see a doctor about infections and other health concerns instead of suffering in silence?
You know, in the last 20 years, there has been only one type of medicine that has been available to treat these yeast infections. So there are patients that I can understand that would just rather suffer in silence than go to their healthcare provider or even go to the drugstore to buy creams for these yeast infections, because it's the same thing over and over again. And some patients just don't get relief from that, and therefore they get discouraged and choose to sit at home.
Well, I know there's been some new advancements. Is there a website where we can learn a little bit more information if we want to get more information?
So actually there has been a new medication that was approved in the last year. The name of the drug is Brexit Fem. It works in a different way, and it's a different class of antifungal. That is drugs that treat yeast infections. A different class, novel class. Brexit Fem, and it's 2 tablets in the morning, 2 tablets in the evening. But it is not for everybody, particularly women who are pregnant. So you need to speak to your healthcare provider to see if it is appropriate for you.
Okay, and what is that website if we want to learn a little bit more?
So to learn more about this and about your vaginal health, you can go to yourvhealth.com. Now the V is for vagina, so yourvhealth.com for more information.
Wonderful. Well, thank you ladies both so much for your time today. And yes, women, go talk to your doctor. And if you'd like to see this segment again, just head to our website, firstcoastliving.net.